Hey, I'm Dr. Ruth Roberts, the original holistic pet health coach, and I am so glad you're here with us today because Denise Bozenski is here with me. And you honestly, you do have more initials after your name than I do for sure, because you just seem to be a lifelong learner. But
Yeah.
for those of you that do not know Denise, she lives in Phoenix, Arizona, born and raised outside of Philly, New Jersey. Her background started in law enforcement, and now she's been a professional dog trainer for 9+ years, plus a certified canine nutritionist and a certified canine fitness coach. And she's certified in bodywork therapies that include canine massage, small animal acupressure, cold laser therapy, craniosacral therapy, canine kinesiology taping, ANMR, aromatherapy, raindrop therapy, Reiki master, and finishing up animal communication in your spare time. And
Yeah.
she is a holistic pet health coach. So she has a whole other list of therapies that she knows, if that was not enough, and that she's either learning or she wants to accomplish. But her dogs are the reason that she does everything. Penny, Pearl, Rhea, Yahtzee, and Poppy are the kids that keep her moving. So, Denise, welcome. That is an incredible amount of stuff that you have taken on learning.
Thank you. Thank you. It's, yeah, never stop learning. And like I said, I have a whole list of other things I want to do, but right now we're focusing on the here and now and how I can help pets and their owners with what I know currently.
Amazing. How did you decide to transition from law enforcement into dog training, or were you working with canine police officers?
Well, originally the plan was to go canine with the agency that I was with, but life happened and, had some curveballs thrown in there and never actually ended up going that route. There was a few restrictions that didn't help it either. I was in the DC area, very hard to own a house there. And at that time you had to have a house, and it was just not something that was feasible. They started changing those restrictions after the fact, but got out of law enforcement, just ultimately burnt out. It was married to the job. The agency that I was with was, a constant more work than work-life balance. So decided that enough was enough and moved out to Arizona where my family had relocated and tried to be a civilian, a civilian normal job, 9 to 5, in an office, and hated it. So got back into the security world for a little bit before I decided, what, who am I trying to kid? I grew up wanting to be a veterinarian and, love dogs, have always had dogs. So decided it's time, it's time to do what I love and not just do what I should be doing ultimately. So I got into dog training and have been doing that for over 9 years now. And then within the past 18 months was when I really decided to do trainings for the holistic world and started with, the health coaching. And well, actually, nutrition was 6 years ago. Did that and then decided, nope, I need more. I need to do more. I need to learn more. And it kind of took off from there and been rolling ever since.
That's amazing. So, all right, so you went from law enforcement to dog training, and then how did you jump from dog training to all of these other modalities you're employing?
Ultimately, there's a couple whys to it. The holistic health coach part was I had lost one of my soul dogs to hemangiosarcoma only a few weeks after her 4th birthday, and it was very unexpected. And here one day, gone the next type of deal, and it was very heartbreaking for me, of course. I thought I was doing enough with the raw diet, but realized, there's more. There's more than just what's in the bowl. And then about a year later, one of my dogs that I had trained, who now I affectionately call her and her sister my step dogs because they're part of the family now. They're here, they come and hang out once or twice a week just to play with my girls. And she was diagnosed with hemangiosarcoma. I think we were within a month of her 2nd birthday. And because I didn't have the time to help my own girl, I dug my heels in and I said, this one, I have to help her. I have to, I have to do whatever I can. So I started, doing the research, have guiding her dad on what to do. We were able to actually get her in with the Yale vaccine trial for that. Yeah. And she's been cancer-free now for 2 years. But as that was happening, it was like I was realizing there is more and more for me to learn. So that's when I got into the holistic coaching part.
So wait, I want to back you up 2 seconds. So this girl has been cancer-free from hemangiosarcoma for 2 years.
Mm-hmm. It was cutaneous, so it was a bump that they diagnosed as hemangiosarcoma on her leg. They removed it. They did not remove it with clear margins, is what they said at the time. And then we found a veterinarian out here in Phoenix that had access to the Yale vaccine, and that would have been probably about 6 weeks later after her surgery and diagnosis. And we were able to get on that, and it was a decision her dad made. That he didn't want any chemo or radiology or anything, even from the start. So it was like, okay, let me do what I can to see what I can find out, to see how we can, help your girl.
So I'm gonna keep interrupting you. So what did you do to help support this dog?
So we switched her over to a raw diet, of course. Supplements we added were UNAM Bio. We do 5 days on, 5 days off. And then our high doses of turkey tail, and then omega-3s, probiotics, just to keep her immune system, nice and healthy. And then we do have a couple of Chinese herbs that the integrative oncologist had scripted for us. So that's her daily routine. And then obviously cleaning up her everyday life, making sure the cleaners they're using at home, aren't toxic, just, basic cleaners, vinegar, water, and even, like alcohol. And keeping her clean. She's a Portuguese water dog, so she does require grooming. So making sure we're using groomers that are using safe products and just not your run-of-the-mill, shampoos that are filled with fragrances or anything like that. Making sure she's on filtered water. So that, she's not taking in, our water out here is terrible. Of course, we're in the desert. So, making sure she's on filtered water and just getting the best from that. And then of course, obviously keeping her stress-free, and emotionally happy, which is not too hard to do. I mean, I think we're 4 years old now. So, she's still very active. So yeah.
So it was probably harder to teach dad to be a little calmer. Is that fair?
No, he's pretty good.
Cool.
He's pretty good, pretty level-headed, and we had established a really good working relationship to begin with, as me training her and training her sister, and then that relationship evolved, with the trust of what I was doing to help him with her.
I love this because this is exactly what I wanted to have happen with holistic pet health coaches, to help work with pet parents and figure out all of the options, and then let the pet parent make the choices instead of you've got this or that and that's it.
Yeah.
So well done. Because cutaneous hemangiosarcoma, typically with unclean margins, comes back within 6 months with a vengeance. And these guys aren't. Yeah.
Her prognosis, I think they gave her a little under 300 days.
Yeah.
For survival. So
exactly. So high five, virtual high five.
Thank you.
So, all right. So I interrupted you. So you ended up going into the HPHC program and doing all these other things. So, this is just amazing that you've picked this up. Like, here's the next thing I need to add on. So is that kind of what happened? You went like, oh, I need to do this. And like, oh, and then I need to add this in. Is that?
Yeah, so to speak. Then comes in my other Y dog, which is my senior dog, Penny. She turned 15 in February, and we've gone through a few holistic vets, and basically what happens is they stay in a practice for a little bit and they leave and relocate elsewhere. Then the next one comes in, leaves, rotates out. So it was getting tougher and tougher to find her that help, and it got to the point where it was like, you know what, if I have access to be able to learn this stuff myself, to be able to help her and help her on a daily basis, I'm going to do it. So I found the courses, started doing them. And, as I got into it, it was, why not be able to help other dogs as well, other families, even dogs that are coming into training for me, because I do still train as well. It was a situation of, I did it for my girl, but then spread the wealth, spread the knowledge. And, in my area, there aren't many bodywork practitioners. As a matter of fact, there's one rehab veterinarian in my direct vicinity. And then there's one other company that does hydrotherapy, and they do massage, but they also do, your exercise and conditioning. So it was like, look at it, there's a need. People don't realize they need it yet, but there's a need. And once they start realizing it, we're going to need people that can help them with this. So it was, kind of a snowball effect. I did it for my girl, and then it was keep on going.
Rinse and repeat. Right on.
Yeah.
I love that. So holistic body work, I mean, that sounds like the yoga princess woo-woo stuff, but what is that really? And how are you able to apply these techniques to really help with pain and mobility issues?
So really it's a mix. There's some woo-woo in there. Holistic, physical, we have the physical part of it, we have the emotional part of it, and then the energetic part. So it's really, a mix of a few different modalities. Our hands-on is going to be our massage, which is just like our massage for humans. We're reducing inflammation, we're releasing tension in the muscles, and we're doing this for dogs that may be sore, maybe have chronic conditions, even post-surgery type of conditions. Our other hands-on modalities are going to be acupressure, which is acupuncture without the needles. We're using pressure instead. So, we're increasing the energy flow. We're working on that inflammation as well. And with acupressure, there's a few ways that we can really apply that pressure. It can be pressure from our hands, our fingers. We can use laser torches, or, incorporate like a red light type of modality. And then, there's also tuning forks, so frequency for these acupressure points. So, that's another more hands-on, but also energetic modality. We have ANMR, animal neuromyofascial release, which is going to target specific neuromuscular imbalances and help get the body flowing and moving properly again, and communicating, from the spine to the brain, how it should be working. Going through my list of all the letters in my head that go behind my name. So we have, cranial sacral therapy, which is going to be a gentle technique, which releases restrictions in the cranial sacral system. So your brain, your spinal cord, your cerebral spinal fluid, and the membranes that surround it. This is going to help to relax and improve mobility as well. That helps if you have, any type of spinal or neuro issues. And then what's catching fire right now is our red light and our cold laser therapy. That's going to be your red light therapy that's, addressing inflammation, reducing it, promoting cellular growth and repair, and then enhancing the mobility. And that's going to be, when you have your joint pain, your arthritis, and any type of mobility issues. And then another one that many people don't realize is kinesiology taping. Just like athletes or people can do it, for humans, we can actually use kinesiology taping for dogs and other animals to help support their muscles, to help, their ligaments. And this is really good for proprioception, or if we have to improve mobility, post-surgery, and then athletic injuries, or just overworking, even, working canines can benefit from kinesiology taping as well. So those are going to be, our hands-on with a little bit of energetic. And then, our energy healing is going to be our Reiki sessions, aromatherapy, raindrop therapy, which is a form of aromatherapy, except you're using specific essential oils with massage, which helps to improve circulation. It helps with chronic pain, and it helps as relaxation as well.
Right on. And that's interesting. And you may, I'm guessing at least, that you may see a dog and decide, okay, I'm going to do this, but the dog's like, I don't think so. And so then you kind of, that's wonderful because then you can switch to a modality that they're going to accept more
Correct.
easily. Is that
Yeah.
fair? Yeah.
Yeah, absolutely. I mean, some of them are going to be depending on, how much pressure we're using, what tool we're using, or, if there's not hands-on at all, okay, Reiki can be done without, physically touching. It's that energy healing. So it's the energy you're passing along, but that doesn't have to be through physical touch either. And same thing with, with your aromatherapy, if you're diffusing, the essential oils, that has those benefits without any type of touch either.
That's so wise because that's what I found in when I was doing acupuncture in practice
Hmm.
is that, what they taught us was needles or electroacupuncture. But
Yeah.
there are dogs that are so and cats that are so sensitive that
Hmm.
all they could handle really was a laser stimulating the acupoint or physical stimulation of the acupoint. And
Correct.
oddly, sometimes aqua acupuncture, so using B12 at those acupuncture points. But
Hmm.
it's like I've got enough stuff going on. I don't need a sledgehammer. I need a very light touch.
Yep.
So that's amazing that you're able to incorporate so many different techniques to bring that animal in front of you exactly what they need at that moment.
Absolutely.
Beautiful.
And it's a mix of them, it may be one week we're doing this, next week we're doing this, and they may have the same similar benefits, but they're benefiting in different ways. So that still, that overall, that holistic wellness, we're addressing the root from different angles, the root of the problem, rather than just, okay, we're set, this is how it has to be, and that's it. And then they're just getting that one form of therapy.
Right on. Well done.
Thank you.
So, this is something a lot of people may know for themselves, but in humans. But do you find that body work can help with problems that aren't musculoskeletal? So, anxiety, allergies, or GI problems, for instance.
Yeah, absolutely. They can help with all of that. Reiki is going to be a big one for all of them, again, because that's that energy healing, that we're doing, and just getting that energy flowing, their chi flowing the way we want it to. Um, Acupressure, again, certain points, there's points everywhere in the body that's going to affect some sort of system. So, we can have, a specific point that helps with calming a dog down. I use the calming ones a lot for dogs that come in training because I do get a lot of dogs that have anxiety, separation anxiety, or just anxiety in general. So, I'm using the calming points, I'm using grounding points for them.
Mm.
For acupressure, just to help them relax. And that's in combination with the Reiki. Aromatherapy as well. That's going to help calming. Your most common ones, lavender and chamomile, are going to have that calming and relaxing effect for dogs. And then your raindrop therapy is going to be a combination of specific essential oils that we're essentially massaging down their spine, down their back, so that they can get the immune system support, and reduce inflammation that may be going on with your GI issues, or your allergies, the inflammation that is just so common in the bodies that you don't see.
And that's so cool. And it's like we don't. So I've heard a lot of human massage therapy practitioners talk about they are spending half of their time just getting people to come back in their bodies. Are you finding that with dogs as well?
Um, it depends on the dog. Every dog is going to be different. I mean, some it's, they take to it right away, and they're right into it. Other ones they fight it a little bit at first. So,
Yeah.
we take it slow, and we do what modalities we can, whether we start off with the Reiki just to help them relax more, or we incorporate the aromatherapy just to get them a little more relaxed. And then once they realize, that they do start to feel better, then they relax, they accept it more. And it may take a few sessions. It's not necessarily we're doing this in one day in one session. It takes a little bit, because sometimes these dogs are hurting enough where they just hurt no matter what. And they're going to associate anything they feel with that hurt. So we have to start, getting that association with, okay, this hurt is going to start to diminish, or this, uncomfortable feeling will start to diminish as we're doing this. So sometimes it takes time, sometimes it's quick. It really depends on the dog and what specifically they have going on.
Amen. And that's it. We're dealing with individuals with
Hmm.
a complex set of issues and other
Yeah,
concerns. So that's
yeah,
it. We have to tailor it to each individual animal. And
exactly.
and do you feel like this is something that pet parents can do at home, or that just someone that's a trained professional needs to be doing?
So it depends on the modality. It depends on what we're working with. I mean, we can do, gentle massage. There's acupressure points that we can teach, the owners to do at home, in between sessions. Even red light therapy. I mean, you can buy, low level LED lights now that you can use at home, that, are still going to be safe. There's not going to be any type of, physical safety concerns with those. And I like to have owners working in between sessions with their dogs, because, that's just continuing the process. It's not just, okay, once a week we get this great feeling, and then come the next week, we're kind of right back to where we started. And, it's just that vicious cycle. We're going around in the wheel. So by teaching owners how to utilize what I'm doing, so that they can do it at home as well for those in between times, and just keep that process going. There are modalities that we can do that. Even kinesiology taping, we give them a roll of tape, show them how to cut it, where we want to put it, and what, percentage stretch or non-stretch we want the tape to be. That way, if the tape falls off before the next session, or, the dog jumps in the pool, they can reapply and know that we're doing it properly, rather than, well, it fell off, we have to wait till next time. So, there are modalities for that. There are other ones that, can't necessarily do without the training, and that's where I come in. So your ANMR release, we're going to want to be
Yeah,
trained
that's a
for that.
super specific technique. Right on.
Yeah, exactly. Same thing with
Yeah.
cranial sacral therapy, and even a little bit of aromatherapy, depending on what it is. Raindrop therapy specifically, because we want to make sure that, we're diluting properly,
Yes.
putting the essential oils on the dog properly, and massaging them properly, so we don't have any type of adverse effect from those.
Sweet. And I think I love what you're doing, is that you're applying things that you know how to do and that have taken a great deal of training, but
Hmm.
you're also educating your pet parents on what they can
Right.
do at home to keep that progress moving. I think that's so
Absolutely.
critical.
Well, and it's
Um,
important for parents to feel a part of it too.
yeah.
We want them to have that intention that they're helping. And even if it's just small, gentle, movements or touch, that's still going to be something that's better than nothing.
Sweet. Yeah, that's perfect. And that's it. I mean, I think that if people have the training and the knowledge
Mhm.
to support their pets, they feel more empowered to be proactive and to pay attention. Like, wow, when I did this, I saw that my dog relaxed and just
Yeah.
melted and passed out. Okay,
Hmm.
cool. So
Yeah.
now I know something to do if he's getting uptight. That's
Right.
perfect, perfect
Yeah.
stuff.
And I'd
Well,
rather teach them how to do it the right way than have them try to do it themselves, and now they're doing it the wrong way, and, we're having issues down the road with, with whatever they've done incorrectly. And, this isn't these modalities aren't any secret. I mean, I was able to find them and take the courses and certify. Anybody can. It's just a matter of, if people want to, or if they want somebody else to help them with it and then guide them along the way.
cool. So, what would you suggest to pet parents not to do when it comes to body work and some of these other modalities?
I think the big one is going to be pressure. Using too much pressure, whether it's for the massage or acupressure. A lot of us go to massage therapists and we see deep massage, and we're like, oh yes, really grind into those muscles for us to help us. But that's not
And we
always the
fall, we're
case.
like, "Oh god, this
Yeah,
hurts so good."
yeah,
Yeah, and
yeah.
so
It
yeah,
hurts so good. That's not the case for our dogs. It's we don't want it to hurt so good for them, because they're not going to really communicate that to us, other than saying they don't want it done at all now. And now we've, potentially put them off to something that can really help them. So, making sure that the pressure isn't too hard. We're not doing that deep seated massage for them. And making it, possibly further, injure them. So
Right.
that's going to be one part. Attempting anything that they really don't know how to do just because, well, I saw it on a YouTube video, or, I saw you doing it. Specifically like our ANMR, our cranial sacral therapy, even the K taping, because we don't want them to cause more discomfort,
Right.
or again, to further the injury. We want to make sure that we're doing things in a controlled environment, in a controlled sense, not going past our limits of what we actually know or how to do it, so that we aren't causing further damage or further issues. And then, the obvious one for essential oils is, using them incorrectly, or using ones that are toxic because we think that they're okay, or because, an influencer said, hey, they're okay. That's something we really want to steer clear from, especially with the essential oils, because, those can cause more harm than good as far as the ones that are toxic for dogs.
Right.
But
And I think, and especially in it sourcing in that area is
mhm,
incredibly important too, because you go into Whole Foods and you think, oh, it's Whole Foods. Well, no, a lot of the oils that are there are not uh, are not as clean as we would like them to be.
correct.
And
Yep.
and so we can end up with a tainted oil, which can end up creating more symptoms. And then we're like,
Mhm.
well, this stuff doesn't work.
Yeah,
So
exactly. So, and that rolls into, using proper equipment, using the correct tools. You order a red light, online on Amazon or whatever, and you start using it. And, there's certain levels to it. There's certain, strengths to the red light, so to speak. So, some do require, eye protective eye gear. Some that, are a lower level may not require it, but knowing the equipment you have and how to use it properly, is another key factor in all of this as well.
you mean we don't want to just set it to level 10 all the time?
No, no, not all the time.
And that's something that's really hard for a lot of us to learn. I mean, as a veterinarian, we wanted to get it done fast, but
Mhm.
that fast and that intensity can actually backfire on us. So I
Yeah.
think that's really an important thing for pet parents to keep in mind is that yes, we can buy this device that has 10 times the strength of the competing device,
Mhm.
but that may not be beneficial for our pets after all, and we may
Correct.
need a much lighter touch
Yep.
than we understood.
Absolutely. Yeah.
Cool. So, what's the first success story you had that made you realize that all this woo-woo and all these things you've been learning really does does work? Ooh,
I mean, really, it's going to be the one that I've done the most work on, which is my own girl Penny. Through these certifications, you're doing case studies, you're learning, you're practicing hands-on, and she was the subject for probably more than half of my case studies, because she's ultimately why I was learning these things. She has hip dysplasia, she has arthritis, she's torn both ACLs in her life. So, she's 15 years old, so she gets around like she's an old lady. So, seeing the different modalities work for her, and just seeing her be able to get around more comfortably. The realistic part is she may not run around like she's a puppy anymore, but just seeing her be able to get up and lay down with better comfort, want to go on her daily walks, that is, what that's why I'm doing this. It's why I started it, but it's truly, my number one success for her, because we've done the massage. I do acupressure with her a few times a week now, because she has me here. I can do all the modalities, so it's a matter of spreading out and, which ones are working this, point in time. But, we've done the acupressure points for arthritis and hip dysplasia. She gets her red light therapy almost daily, and you can see the difference when she's having these done. The one modality she does not like is ANMR. She
interesting.
she does not like that. And one of the holistic vets that we did have has done that on her in the past. And I think it was more of a traumatic experience, because it was just
Mm.
pow, 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 pow. And looking back at it now, it's like, wait a minute, like, was she really doing that the way I would do it? Like, so I think it's more of that, like, no, don't do that again. I didn't like it the first time.
Yeah.
But we've done K-taping on her, and like I said, the acupressure and obviously massage, um, and aromatherapy, for her. She really loved the raindrop therapy, which kind of surprised me, because I thought for her, after the first one or two oils in the sequence, she was just gonna be like, I'm done with this, bye. But she totally
She
relaxed
thought it was
and got
awesome.
into it. Yeah. So she was obviously my why, and the success of seeing from her is what made me want to, push even further with it.
Amazing. Cool.
Yeah.
I got to answer this question for Monica because I think this is something that is so common for pet parents.
Mhm.
Um, it it is confusing. And so do you feed grain free? Do you feed raw meat? Do you feed cooked meat? Do you do this? What do you do? And this is the thing right now is there's so many influencers saying so many different things. And ultimately, Monica, it boils down to what does your dog need? So I teach cooked food. Denise has had really good experience with raw diet. But I think what it takes is experimenting and figure out what works best for your dog. And regardless, I think if you go from a kibble diet and do nothing more than add in some vegetables, some raw meat, some toppers, so to speak, and start down that pathway, your dog is going to help you figure out what they need. So if you're throwing vegetables on top and they're like, no, but you throw some raw meat on top and they're like, yes, then that's going to give you a clue of where to start going for your pup. So, Denise, have you got some comments on that too?
I think it's, with any coaching, with anything that we're doing, with any training, we have to look at the dog that's in front of us. It's we don't want to get sucked into, well, it works for these dogs, so we have to do it for all dogs, because that's the path that everybody's now on anyway. And same thing with the path of convenience. What's most convenient and what's just easiest, and that doesn't take into account of what are we looking at right in front of us, what are we dealing with this dog. So I have 5 of my dogs are on raw, and one of my dogs is on cooked because she has IBD, and she just can't handle the raw. She can handle cooked just fine. She has other sensitivities too as far as ingredients, but it's really treating the dog in front of you. I can't necessarily say, well, my other 4 are on this, so you have to be on it too, whether it makes you feel good or not. So
Get over it. Get your gut right. Yeah,
yeah, just
exactly.
really, really, pairing up with somebody, you know, the consultations with coaches are huge, because, now you're working with somebody that is directly addressing your dog's needs, as opposed to just, well, this is what we did, so that's what everybody should do. That's what influencers are. This is what we did, so everybody do it. Maybe not, with that direct message, but that's ultimately what it is. So, working with somebody that can work with you directly, one-on-one, and deal with what you have going on right in front of you with your pets.
Right on. And this last part where she's 90 pounds and she's got a limp in her left rear leg from jumping up. So that's
Mhm.
telling you that there's some pretty heavy duty inflammation in the body,
Yep.
and maybe she's done some lamp damage to that knee. So, Monica, this is where, that part probably a vet ought to check out, but
Mhm.
figuring out how to prevent this from getting worse, this is where working with a holistic pet health coach is really, really amazing. And so if you're in the Phoenix area, that's where Denise is. I've dropped her website in, and this is where you can reach out to her, see if it's a good fit to work together. But since you've already that your pup has got some issues in terms of knee problems, this she's your person to help start you guided down that correct path to healing.
Mhm.
And
Yeah.
so Teddy's asking what kind of red light to purchase, and how do I know what setting to put it on? So
I mean,
like $1 million question.
that's $1 million question. I mean, sometimes for some people, money is going to play a part into it. There's red lights out there that are $1,200, that work just as well as your $100 one. But there's different there's different types of red lights. There's going to be your low level LED light, which is going to be what you find the most. That's typically ones where you don't necessarily need to have the goggles or glasses on, because it's not emitting that laser light. It's an LED light. Those settings, it's really going to depend on what you're dealing with your dog, what you have going on. Those lights, those settings are, the settings are one part of it, but the time of it's going to be the other part. So it may be a situation where we do a low setting for longer, or we do a higher setting for a shorter amount of time. So that settings are going to depend on what's going on, and time-wise what we're doing. There's also, stronger lasers. There's level 3 lasers. There's level 4 lasers, which is what you're going to see in vets' offices typically. This is where you're going to need to have, more safety factors taken in. You're wearing glasses, dog's wearing glasses, whoever's in the room is wearing glasses. These are going to be, stronger types of laser therapy, where your times are most likely going to be significantly shorter than, say, an LED laser light.
Right on.
Not all of your lasers out there are going to tell you what they are. They're just going to say red light therapy. Most times those are going to be your LED lights, more so than your level 3 or 4 professional lasers.
Cool. So Teddy, long story short, reach out to Denise on her website, and she can talk with you, find out what's going on with your pup, and help you make some better selections. Cool. One of the things that gets a little overwhelming sometimes is when we've got this dog that's been painful forever and ever and ever, and the vet's given us, these drugs, that drug, Librela, what have you, and the issue is that we still don't see pain relief.
Right.
So how would you start working with a client that's got a dog that's got chronic pain? Where's your first place you're going to go?
So first place I'm going to go is internally. We're going to look at, there's going to obviously be inflammation. How can we work the inflammation from the inside out? So we're going to, assess diet. We're going to assess, what type of supplements, the dog is getting, not getting, what we can add in that way, and work on it systemically. And then we'll add in the outer layer, the massage therapy, the red light therapy. It's going to depend on, where that chronic pain is, as to what we're actually doing. It also depends on, what type of commitment that we can get from the owner. Are they comfortable taking a roll of K-tape home and cutting it and putting it on their dog if we need to reapply it? Are they comfortable doing, the acupressure points? Are they comfortable doing the massage? Because when we get to this point, of those chronic issues and them seeing their dog constantly in pain, they're afraid to touch their dog at all. So,
Really? That's,
it's just like, they don't want to, every time, I've touched my dog here, they jump and yelp. So, I'm not going to do it anymore. So, we have to think of it that way too. The modalities, how much are you willing to put in? How much, how often can we meet for that outer layer? But, that inner layer is going to be just as important. Diet, supplements, environment, looking at what the setup in their house is. Do you have all tile or wood floors? Is your dog slipping around? Are we lending to what's going on just in, going from point A to point B in your home? Do we have to get, carpets to lay out so that your dog, can walk on a softer surface that's not going to be slippery? My girl hates the carpets. I went and I bought rugs and runners and everywhere, and I put them all over the place, and she would physically go around them. It was short of having to actually carpet, wall-to-wall carpeting. And it was like, well, I'm in Arizona. I'm not putting carpet, in my entire house. That's just crazy. So it was, I found a pair of good booty socks that have grippers, almost like your hospital socks, that she tolerates, and she has them on, and that helps with her getting up on the tile, laying down, and then getting around. So that chronic pain, there's just so many pieces of that puzzle to help with that, in addition to just, okay, we're going to do a massage today, we're going to do, acupressure today. It works from the inside out, and then
Right.
their whole entire surroundings.
And that's great, because I think that's the thing that most of my colleagues, in the short period of time that we have to work with the client, we're just like, okay, your dog's got a partially torn cruciate ligament. Do this and this and this and give these pills. Come back in
Yes.
3 weeks. And
Mhm.
that's why, again, it's so critical to work with somebody that can be your trusted guide, help you figure out what's going to work for your dog and what's not going to work for your dog. And Jeanette, I mean, you're dropping in here stuff you're feeding and not feeding, but your boy can't eat raw because he's intolerant. But from what you're dropping, the diet may not be completely balanced, and that's part of what Denise was trained to do as a holistic pet health coach, is figure out what your dog can tolerate and then help you create a balanced diet.
Yeah.
And I'm sorry, I'm not sure if that feedback's coming from me or you, but anyway, it's all good.
Yeah.
Cool. Any parting words of wisdom we haven't gotten for these folks?
I think it's just, it's your dog's we're talking about dogs that have issues a lot of times, but these modalities can help your dog when they don't have issues, just to help them feel better. And they're also helping your dog, especially if you start doing some of these, gentle massage as a puppy. You're teaching your dog that touch is good, touch is not a bad thing, so that when you do go to the vet, they're less inclined to be reactive or to be uncomfortable. But also, we have dogs that are working dogs. We have athlete dogs. These may not be injuries that they're dealing with, but, just the wear and tear that their bodies are taking. These modalities can help to make them recover and feel better, but also help to keep some of that. Sorry, my dog just laid down and stretched along the camera tripod. But those modalities aren't just for our old dogs. They're not just for our senior dogs. These can help our our healthy young dogs and middle-aged dogs. So keeping that in mind, that being proactive rather than reactive a lot of times is more beneficial than just waiting for something to happen to then work on it.
Really?
Yeah. Amazing, right?
So, Denise, I want to thank you for joining today. It's been a delight and a pleasure. And thanks for joining and bringing this wealth of information. And so reach out to Denise on her website if you need some help, whether you're in Phoenix or not.
Yeah, definitely. I'm available, even if we can't necessarily meet in person. There may be a referral that I can give you to somebody I know in your area, or I may be able to guide you on what you can start doing in the meantime until, you can get that hands-on help that you need.
Cool. You guys have a great week. We'll see you next week. Take good care. Thanks.